Hello, my name is Daniel Bichet. I am a nephrologist and professor of medicine at the University of Montreal. I will present you the long-term renal efficacy and incidence of Fabry-associated clinical events in the treatment-naive and enzyme replacement therapy experienced female patients receiving migalastat for Fabry disease up to 8.5 years. These slides concern the objectives of the study. Fabry disease is a rare disease, X-linked, multisystemic, which is a lysosomal disorder caused by pathogenic variants of the gene GLA. It is affecting both males and females. However, diagnosing Fabry disease in females is more difficult, and deciding when to initiate treatment is challenging. The assessments here were eGFR measurements and Fabry-associated clinical events, that is, FACE, that we will see throughout the study. FACE could be alteration in glomerular filtration rate, or could be changes in cardiac parameters. Also, cerebrovascular events or transient ischemic attacks could be recorded, as well as death. Fortunately, there was no death in this study. The baseline clinical characteristics of the female patients, the 60 female patients studied here, are presented. As you can see, they were divided into ERT naive patients and into ERT experienced patients. The ERT experienced patients were slightly older, but both had good glomerular filtration rate, and some of them had some increased left ventricular mass index, as described in these slides, mainly patients with previous exposure to ERT. This is the eGFR in 47 female patients who received migalastat for more than 2 years. eGFR is reported by treatment status with or without multi-organ involvement and by baseline eGFR. There was a stabilization of eGFR both in the treatment-naive and ERT-experienced patients. The rate of yearly eGFR decline was similar to female patients receiving agalsidase beta in the Fabry registry and within the normal range of a healthy population. The conclusion, too, is that treatment with migalastat demonstrated low incidence of FACEs up to 8.5 years in female patients with Fabry disease. In fact, 83% of female patients did not experience a cardiac or cerebrovascular event, and 100% remained free of any renal event during the observation period. As you can see here, 5 FACEs were reported in the treatment-naive group, 4 cardiac events and 1 cerebrovascular events, and in the ERT experienced group, 3 cardiac events and 2 cardiovascular events, resulting in incidence rate of 31.5 and 40.7 events per 1,000 patient years, respectively. So that, as expected, all FACEs occurred in female patients with multi-organ involvement at baseline and who had experienced FACEs prior to migalastat treatment. Of importance, the incidence rate of FACEs in female with multi-organ involvement was 46.3 events per 1,000 patients year. I thank you very much for your attention.